Good morning, Stuart, Florida. My name is Dr. Tred Rissacker, and I am the doctor, the owner, and a client at my Slim Body Laser Spa. I'm located here in Stuart on East Ocean Boulevard, right across the street from the Fresh Market on Ocean Boulevard, which is the road that leads you out to the beaches. If you're not familiar with Stuart, it's at the corner, the intersection of Monterey Road and East Ocean Boulevard. It's wonderful. I'm using a non-invasive, FDA-cleared low-level laser device, which targets subcutaneous fat. That's the fat that's stored on the outside of your body, in front of your muscles, underneath the skin, the stuff that's kind of hanging over. And when you're young, none of this really applies, by the way, because your hormones and everything are fantastically keeping the body weight off and allowing you not to accumulate too much subcutaneous fat. But as you get older and your hormones change, hence we have this accumulation of stubborn fat. And that's exactly what this process is designed to target. It works every time. It's predictable. It's reasonable. It's really quite amazing. I've been doing it now for many years. And I just want you to know the reason why I'm doing it is to help you find an easier, sure, guaranteed way that you can reduce body fat. You know, that's really what we're doing. We're reducing body fat using a laser so you don't have to exercise and diet and wonder if it's going to come off. There's a lot to losing weight. There's a lot to losing body fat. And I wish the two were equal, but they're not. You can step on a scale and drop 10 pounds, exercising and dieting or whatever it is you're doing, shrimping calories, and you can lose 10 pounds of weight, but it doesn't mean that you've lost 10 pounds of fat. It just means you've lost some weight. And in fact, you could have lost precious muscle tone, which is the only thing that's going to defeat the fat. So without knowing your numbers, your ratios of body fat versus lean muscle, which is the only way to do that is to go to a provider like me, a dietitian, nutritionist, maybe a trainer has this technology. It's called a body fat analysis. And that's how we determine by passing a very mild electrical current through your body from your foot to your hand, and water, bone, muscle, fat, conduct electricity at different rates. It's called impedance. It impedes the rate of electricity. And when you put that in with your age, your gender, you know, your sex, male or female, not gender, male or female, and also your height and your overall body fat weight, it gives you an error. It gives you a number that's a 3% correct of your percentage of body fat, how hydrated you are, your total body water, and another thing, which is very important, called your resting caloric intake, your BMR. And that's how many calories you can eat a day without gaining weight. And without knowing that number, you really can't target any weight loss. I mean, you can target weight loss just by starving, but you can't really target losing body fat as the goal of weight loss. Okay. That should be your goal of weight loss, is to lose body fat, not just lose weight and look better on the scale. All right. Now I'm going to give you a little presentation here of it's a really short video that we created, which kind of explains a little bit about what we do. And I think it's interesting and I like it. So I hope you like it too. So here it is. I'm going to add it to the stage and we're going to hit play and you can enjoy it.
The weight loss and body sculpting industry is littered with scams and false promises. From crash diets, expensive injections, and dangerous fat removal procedures like freezing or surgery. Some are a complete waste of time, and some are downright dangerous. That's why we set out to find a safe and effective method that gets results fast. And when we found it, we couldn't believe it. With one simple and painless method, we discovered that a series of 9 30-minute FDA-cleared low-level laser sessions 3 times per week for 3 weeks help patients lose 3 to 9 inches of belly fat. Thanks to Dr. Tred's FDA-cleared laser, there are no harsh diets or strenuous exercise, and no dangerous methods necessary. In fact, the clients relax in their own private room and listen to music during the procedure. Our body sculpting and laser-assisted weight loss practice is owned by Dr. Tread Versacker, who has been a practicing chiropractor for over 30 years. We know you're smart. You want to get the fat off safely with minimum exercise and no downtime. Regardless of your age and past failures, Dr. Tread and his laser is here to help. Call us for a consultation to get started losing inches and shedding pounds the laser easy way.
All right. How about that, huh? That was an explainer video I had done. Whoops. Let's cut that off. So yeah, that was an explainer video. And excuse me. And it was done about 3 years ago when I was only in practice for 30 years. Now it's 34 years. And it really explained exactly what we do in a fun cartoon way. And I just thought it was a very powerful piece. Now, this is another piece which I want to share with you. And this is from Groupon, actually. Groupon is a company that promotes different body sculpting and different procedures. And they made a really nice video which will explain a little bit more about what I do. And you can compare it to the one you just saw in my explainer video. Okay, so let's enjoy this one too here. I'm going to click her on and you can watch it right away. And there we go.
When you hear the word liposuction, you might think of surgery, scalpels, and suction tubes. But laser liposuction can help to slim and contour the body without any incisions. Instead of removing fat cells, this non-invasive treatment empties fat cells out and shrinks them down. Over time, this helps to lessen the appearance of fat deposits wherever they build up, such as the abdomen, waistline, thighs, arms, and chin. During the treatment, pads dotted with laser diodes are placed on, or, depending on the device, just above the skin. The lasers penetrate past the top layers of skin into the layers that contain fat cells. Then, they puncture the walls of those fat cells, causing them to evacuate the fat, glycerol, and retained water they have inside them. This mix of yuck is then moved into the lymphatic system and processed out of the body naturally. But some providers may have you spend a few minutes in a body vibration machine to help stimulate the process. You might see results right away, but most technicians recommend 6 to 8 treatments to see maximum results. And since it's non-invasive, there's no downtime. Just remember, laser liposuction doesn't destroy or remove fat cells. That means they're capable of getting all filled up with fat again. So a good diet and a steady amount of exercise is the best way to preserve your results.
That was pretty cool. I mean, I've seen a lot of promotions about laser lipo, non-invasive. I'll figure this out, I promise. So, that was just a great informative video about how the laser works. That it applies to the skin and it penetrates only about an inch into the skin, and that's right where your adipose tissue is, your fatty layer of fat is in sub-Q. And after 8 to 10 minutes, little microscopic pores form around the cell membrane of the fat cells. The contents is released into the tissue, and then the cells basically collapse and they lose their contents, but they're not damaged. Now, and then she explains that the fatty acid is then moved into the lymphatic system and removed from the body. And that's not true. What's happening to the fatty acids they are being removed, they are being released into the lymphatic system, which then goes into the venous system. Okay, the venous system is the blood which travels back up to your heart. And at that point, the fatty acids pass through the liver and they're converted to glucose is what happens. And those fatty acids then are burned as energy in the form of glucose because the liver transformed the fatty acids into blood sugar, and that gives you energy. So the way the process works is you're really giving up one meal when you do the procedure, because everybody asks, where does the fat go? How do I get rid of the fat? You don't sweat it out. You don't poop it out. It doesn't come out through your urine. It doesn't, it's either going to be burned as energy over the next 1 to 2 hours after the procedure to 3 hours, or it's going to be stored somewhere else in the body as fat 2 to 3 hours later if you fail to burn it in that next 2 to 3 hours. And this is where a lot of centers that are utilizing this technology, and it's safe technology, it's wonderful. But since they don't have the knowledge, a lot of them, about metabolism and things that a doctor would know, like me, and the experience I've had, they don't really understand that it has to be burned as energy. And if it's not burned within that 4-hour window, which is your body's digestive time frame to take a food into your body, chew it up, put it into your system, it goes into the bloodstream, it raises blood sugar, which is a normal occurrence, not in a bad way. And then after 1 to 4 hours after that, your body has to metabolize that entire, what we call, glycemic load. And if it doesn't get rid of it in that 3 to 4 hour window, and your blood sugar stays elevated, we call that diabetes. So if you're not a diabetic, every 4 to 5 hours after you eat, however much food you consumed, this is quite amazing the way the body works. If all of those calories, all of those those calories that you've eaten, whether it's a fat calorie, a carbohydrate, or protein, is going to be digested, assimilated, turned into blood glucose or other like fat and proteins, and your body is going to absorb them and use them as energy. And if it cannot use it all as energy, like you ate more than the energy you need, the extra amount will be made into body fat, will be pushed into the fat cells at the end of that 4th or 5th hour. So, we eat, I don't know, God, I'm hungry all day long, it seems to me, but I'm definitely hungry in the morning when I have breakfast. And then about 11, 12 o'clock, if I have breakfast at 8, by 12 o'clock, I have digested, assimilated, and have distributed all of the food and the macronutrients into the micronutrients that my body needed for that 4 hours. But at the end of that 4th hour, it's 12 o'clock, and you know what? I'm hungry again. We're all hungry again. And then we eat again. That same process happens. We eat the food, we chew it up, it goes into the stomach, it's mixed with acid, it goes into the body, and then it's absorbed by the bloodstream in the form of micronutrients. And those nutrients then are passed through the liver, turned into glucose, all of it, by the way. And then as it goes into the body, we either burn it as energy because we're using muscles. And if we're eating more than the muscles we're working, the excess will be made into fat by within 4 to 5 hours after 12 o'clock. So at 12, you ate, you burned some energy for the next few hours, but you ate more than you burned. And at the end of that 4th or 5th hour, you've made fat, and it only takes 3,500 extra calories to make 1 pound of fat, 3,500 calories in excess than you normally would eat for energy and for work, for muscle work. So knowing that number, your BMR, is critically important for you to know how much food you can really intake. And then, of course, it's 5 or 6 o'clock. We're hungry again, and we eat again. Now, this is time when most people have a lot of problems where they make more fat at night than they do all day long. Why? Number one, you're not as active. So the food that you're eating, you chew it up, it goes into the stomach acids start to break it down from macronutrients to the micronutrients. It goes into your intestinal system. And then the glucose, those nutrients are brought into the liver. The liver converts them to glucose. Now, remember, it's evening time. It's 6 o'clock, 7 o'clock, 8 o'clock. You're probably not at the gym at this point, and you're not going to be walking or doing much exercise. And most likely you ate more than you could even burn in 4 hours. Most people cannot burn more than 300 to 400 calories in a 4-hour period. That's the max. So, but if you had a 1,500 calorie dinner or 3,000 or 4,000 calorie dinner at 6 o'clock, and your body can only utilize 400 calories for work, meaning muscle activity and other things, the extra calories, which were turned into glucose and went into your bloodstream, they either are turned into fat right away within the next 4 or 5 hours. You could have made a half a pound of fat. Now, you say to yourself, well, that's just doesn't seem possible. How could that happen? Is do I really make, you see, what people don't understand is you make fat every time you overeat. You don't make it after 2 weeks of overeating. I mean, you're going to make fat either way. However, if you put your heart to it and your mind to it, and if you have a very large breakfast, like a Denny's Grand Slam in the morning, which is about 1,800 to 2,000 calories, and then for lunch, you have you maybe got the big salad and you got some protein with it, but you also had some bread and you had you had your soda, you had a couple soft drinks because you deserve it. And now you've also snacked on some other things at the same time. Maybe you had half a cheesecake. Now you're up to about another 1,800 to 2,000 calories. And but you only can burn 100 calories an hour approximately. If you're a man. For a woman, it's less than that. And at 6 o'clock, you're hungry, and now you eat again. And this time it's a wonderful evening out at the Bonefish Grill. That's going to be 3,500 calories right there. And that's without alcohol. So in essence, you've taken 2,000 in the morning, 2,000 at lunch. That's 4, 5, 6, 7. That's 7,000 calories for the day. Your body, your BMR is probably around 1,500 to 1,800. Mine is 2,400. I'm a man. I'm 62 years old. I got pretty good muscle tone. I cannot eat more than 2,400 calories in a day. If I do, I'm going to make fat. And here's what happens. Since so many of you are making fat all the time because you're always overeating, your body's insulin system becomes resistant. It tells you, hey, listen, you're not willing to back off on the calories. We can't keep making fat because you overeat. And if we keep making fat, we won't be able to fit out the door of the house after about a year. It can happen. I've seen 1,000-pound people. I'm telling you, 600, 700, 800 pounds. So what your body does is, in its wisdom, it makes insulin resistant, because insulin is the hormone that brings calories into your cell. When you eat food, when you digest it from macronutrient, meaning large chunks, to micronutrients, what happens is those nutrients either are digested, assimilated, and absorbed into as energy, and any extra that's not utilized as energy will make fat. And this is a good thing, if we lived in the 10,000 years ago and we only had 2 weeks to get food, we would eat. You could make 20, 30, 40 pounds of fat in 2 weeks if you really put your heart to it. And then that fat would get you through the next 2 or 3 months without eating. That's the way we're designed. But because we keep going to the plate every single day, 3, 4 times a day, and we're overeating each time we do it, and we're never ever really backing off. We're never going into starvation ever. We are accumulating body fat, and this is what's shutting down the systems. This is what's creating insulin resistance. This is what's hurting your back. This is what's wearing out your knees, all your hip joints. This is what's affecting your blood flow. This is what's causing low libido, where you don't feel like having sex anymore. This is what's creating inflammatory responses. This is what's creating the dental disease and all the bleeding gums. I am telling you, there's nothing more devastating than carrying around too much body fat. And then eventually insulin becomes resistant. And then this high blood sugar in your bloodstream all the time, that's what causes your blood vessels to rot. It's called glycolization. Glycolization. That means glucose is so elevated in your bloodstream that it's collecting within the blood vessels. And since it collects in the smaller blood vessels first, the most, it's collecting in all your vessels, but the smaller blood vessels, they feel it worse. That's what creates the numbness and the tingling and the neuropathy in your feet, in your hands. That is A huge, I mean, and somebody might be saying, well, I don't have body weight. Well, there are the reasons for having glycalization of your blood vessels. It's not always because of body fat, but you know, 90% of you, that's what it is. So, and it comes right back to this. Why are we collecting so much body fat? Why weren't we taught in school about food intake, and how you're not creating any happiness or health or wellness by macking down and overeating? It's really it's slothful. I mean, religion is named it as being sloth. What is it? Slothful? Something not good. In other words, you're just imbibing too much, and eventually your body systems, they can't handle it, and they start to break down. And that's when we show up at the doctor, and he says, or she says, because a lot of MDs that are women now, your blood pressure's elevated. And I notice that you're getting a little portly, and the client's like, no, don't mess with. I like my food. It's the only enjoyment I have. Don't mess with my food. So she gives him a piece of paper that talks about how to lose weight and how to eat more vegetables and get out and take walks, and he takes it, and but something really dangerous happens at that point. The reason why he went into the doctor was elevated blood pressure or high blood sugar or, all these other symptoms. And he's giving a pill to change that symptom. In other words, your pressure's elevated. And if we don't do something to get this pressure down right now, you're at a huge risk of stroke, heart attack, cardiovascular, that just goes on. And you're like, oh my God, I need the pill. Give me the pill, please. I need the pill. Okay, that's great. But you know what it should have with it? It should have a forced look at your nutrition, your body fat percentages, and you should be given a tool, help, a program that you go to and sign up for and start getting rid of the body fat, because that's the cause of the pressure being up. That's the cause. And since the blood pressure is lowered with the pill, and there's a price to pay for that, all drugs have a price to pay for the symptom relief. You're all of a sudden your warning system is back under the radar. You don't think it's a problem because, hey, I checked my pressure and it's fine with the medication I'm taking. So maybe I don't really have to back away from those calories. I like my cheesecake. I make the best oatmeal cookies in the country. I compete, okay, with oatmeal cookies. You can't tell me I can't have my oatmeal cookies. Well, you can't have all your cookies. You can have a half a cookie, maybe one or something like that. But, and this is where y'all are at. This is where I was at. The whole world is here at this problem. We are just digging our graves with our knives and forks. Gosh darn it, that is just the truth. All right, so I'm going to keep this one pretty quick today. I am here to help you. If you need to find out your body fat percentage and you need to find out your resting caloric intake and such, I am having a canned food drive, and it is going on right now. It's going to be Monday the 25th, which is today, right up to October 7th at the spa on East Ocean Boulevard. And in exchange for 5 cans of food, okay, we will put you through and give you an evaluation, check your body fat percentages, give you your resting caloric numbers. And if you qualify, you can even have one laser lipo session to try to see if it's something that could help you. But just the knowledge of what you're going to get from the body analysis that I do and the information is plenty for you to get more effective at losing weight and exercising and dieting. I know a lot of you out there are exercising and dieting, but you just don't know what to eat anymore. I mean, it's so confusing. There's a huge business model made on what you choose to eat. So we don't want that to happen. All right. So it's Dr. Tread's Slim Body Laser Spa. I'm in Stewart. Give us a call, 77. Well, it's going at the bottom of the screen. You don't have me to tell you. I want to help you. We get rid of fat the easy way without exercise or diet, and we have a money back guarantee. So with that, I am going to say sayonara. Thank you so much. I will talk to you soon.